The Department of Education recently made one of the dumbest decisions ever regarding healthcare. They decided that nurses, nurse practitioners, physician assistants, occupational therapists, and physical therapists, among others, are no longer considered professional degrees. Not only is this extremely insulting to some of the most integral healthcare providers that we have, but it will also likely impact staffing of these types of practitioners. We're currently facing an extreme nursing shortage, and it's only going to get worse over the next several years. Now, there are a lot of reasons for this, but one big one is burnout. Surveys show that 4 in 5 nurses face extreme stress while at work. And this has only been made worse after the pandemic, where you get stupid people who don't respect them and will even assault nurses. And staffing shortages, partly caused by poor reimbursements from insurance companies to hospitals, cause these nurses to have to handle many more patients than they can safely handle. Now, on top of that, the Department of Education, headed by former WWE executive Linda McMahon, is now calling them no longer professionals. And this will limit the amount of federal student loans that nursing students can take out. Now, this can't make the nursing shortage worse, could it? Now, the fact is that nurses are the most important part of the hospital system. Yes, even more important than physicians. If all the nurses were to quit their job today, the hospital system and healthcare would fall apart literally within minutes. But if you think about it, if all the doctors would quit today, then nurses can actually keep this shit going for a while. And then you take physical therapists, all of them whom now are required to get a doctorate in physical therapy to practice. They too will be limited in the federal student loans that they can take, so that they literally will not be able to actually pay for schooling. I think Linda McMahon may have had too many DDTs and stone cold stunners that she has lost her freaking mind.
Nurses and teachers are no longer considered professionals, according to Trump's Department of Education, along with physician assistants, physical therapists, nurse practitioners, audiologists, architects, accountants, other education degrees, social workers, other mental health degrees, and a number of other healthcare professions. And this is all to drive people towards private student loans. Because without that professional classification, well, it caps the amount of federal student aid that one can receive from the government at $20,500. If you have that professional classification, well, that's now capped at $50,000. Professional classifications include doctors and lawyers. Degrees that routinely cost $200,000, $300,000, $400,000, $500,000 are capped at $50,000 in federal student aid. The other ones are between $40,000 and $80,000 routinely, and is now capped at $20,000. This is all to drive individuals towards those predatory private student loan companies ran by private equity firms. So while the government's going to make all of us that may be pursuing an advanced degree or a degree in general poorer, they're doing so to enrich companies that are already worth billions and billions of dollars.
Hey ladies, Trump is coming after our degrees. Woohoo! In case you missed it earlier this month, the Trump Department of Education rewrote which graduate programs count as, quote, professional degrees, and it is one of the most consequential attacks on women's economic independence we've seen in years. So we have to talk about it. This summer, Trump signed a bill that capped how much graduate students can borrow and eliminated the Grad Plus loan program entirely. The only way degrees could still qualify for higher loan limits was if they were labeled as, quote, professional degrees. So a committee met to decide which programs would make the cut. And their preliminary results just became available to us last week when the Department of Education's Reimagining and Improvising Student Education Committee reached a consensus on a proposed definition of, quote, professional degree programs under the One Big Beautiful Bill Act of the Trump administration. And here's what they had to say. By the end of negotiations, the Department of Education agreed to recognize just 11 fields: medicine, dentistry, law, pharmacy, theology, and a few others as, quote, professional degrees. They made the very specific and intentional choice of excluding nursing, education, social work, public health, counseling, occupational therapy, and architecture. And here's the part they're hoping you won't notice. The excluded degrees are overwhelmingly held by women. In some of these fields, 80 to 90% of graduates are women. The newly protected degrees are male-dominated fields and often much higher pay. So what does this mean? It means women entering teaching, nursing, mental health care, or social work, the fields that literally hold American communities together, will suddenly be limited to much smaller loans with fewer options to cover the cost of their required clinical hours, licensing, and training. Many simply won't be able to afford these degrees at all. And at a moment when the U.S. is already short hundreds of thousands of nurses and teachers, these restrictions make the pipeline even thinner. They will impact our communities and our career paths. This is not an accident. They might want you to think it is, but it is not an accident. It aligns perfectly with a broader pattern of police work to make it harder for women to enter the workforce in the first place. The Department of Education is expected to issue a notice of proposed rulemaking in the coming weeks, which will open a 30-day public comment period. So you must use this time to be vocal on this, as it will shape women's lives for decades. We will not let them just push us out of the workforce.
Welcome back to Likas Tech. Today we are talking about something a lot of people have no idea happened. The Trump administration actually removed nursing from a list of professional degrees. Can you imagine? Yes, you heard me right, nursing. Guys, let me break down what it really means and why it is matter to the people of United States.
Nurses are not professionals. Now, hold on, before you get really upset with me, that's not me saying that. That's the Trump administration saying that. The Department of Education has labeled that nursing degrees are no longer professional degrees. But don't worry, because theologists, they are professionals. That degree, that got bumped up to a professional degree. Make sure all your nursing friends know that the Trump administration doesn't think that they're professional.
The Department of Education just said that nursing isn't a professional degree, but veterinary medicine is. Here's what's happening. Trump's One Big Beautiful Bill caps graduate loans and creates new borrowing limits. Students in, quote, professional degree programs can borrow up to $50,000 a year annual. The official list of professional degrees includes medicine, pharmacy, dentistry, law, veterinary medicine, chiropractic, and even theology. What's not on this list? Nurse practitioners, physician assistants, and physical therapists. The government's reason? Well, the Education Department says the definition has been consistent for decades, and this is about holding universities accountable and controlling tuition costs. But here's the reality. Graduate nursing students just lost access to higher loan limits and certain loan forgiveness programs. This is happening during a national nursing shortage. So, we trust nurses with our lives, but not with professional degree status. Help me make it make sense. What do you think? Tell me below and follow me. I'm Sue O'Connell. I'm a commentator, and you can watch me at NBC 10 Boston and youtube.com/NBC10.
What's funny is I thought that I was about to go to school to be a nurse practitioner, but I don't think so at this point, because they said nursing is no longer considered a professional degree. I'd like to see these people go to school for 2 years and get associates. I'd like them to go to school for 4 years and get a bachelor's. How about they go to school for 6 years and get a master's? And see how professional that is. Just graduated school. I'm a new grad resident. I had a dream that I was going to be a nurse practitioner. I planned on going next year. But guess what? In 2026, they said that they're cutting the funding. Y'all not getting no more loans, baby. Well, y'all are. But guess what? Y'all only get $20,000 a year. The school I plan on attending is $60,000. To get a master's degree in nursing and science, to become a psychiatric nurse practitioner, $60,000. They're only going to give us $20,000 a year. You do the math. The program's 2 years. $60,000. They're giving me $20,000 a year. That's $40K. Guess what? I got 20 grand I still got to come up with. That means I'm not going to school. Who's coming out of pocket $20,000 just to go to school? When I'm used to getting grants and loans and things of that nature. But now they said no. Figure it out. They don't want us to continue our education. They want us to stay exactly where we at. They want the women to be barefoot and pregnant because nursing is primarily dominated by women. They said, nah. Y'all go ahead, get back in the kitchen, make me some food, and take care of my children. That's what they want you to do. They don't want you to advance. They don't want you to make more money. They want to see where you at. Crabs in a bucket. But you know what? I ain't gonna worry about that. I'm gonna take my talents elsewhere. Y'all better work on y'all businesses. Y'all better get y'all LLC. Y'all better do what y'all need to do. Y'all need to get y'all social media following up. Y'all better collect the bag another way. Because I don't know if you're going to get this other degree. I would like to, but I don't know. They're playing with my top. But it's all right. I'll call you back. Bye.
Trump's Department of Education just made one of the most destructive, backward, absolutely nonsensical decisions I've seen in a long time, and that says something. They've officially removed nursing from the list of professional degree programs under Trump's One Big Beautiful Bill. And before anyone says, oh, that's just a label, no. This means hundreds of thousands of nursing students lose access up to $200,000 in federal student loans. Let me say that again. In the middle of a nationwide nursing shortage, the administration has decided that nursing isn't a profession worth funding. Nurse practitioners, cut off. Physician assistants, cut off. DNP programs, good luck. Your master's, your PhD in nursing, too bad. The American Nurses Association is begging the administration to reverse this because it will crush the future workforce, and they're right. Nurses are literally the backbone of the entire U.S. healthcare system, the ones who actually keep hospitals running, who staff underserved communities, who take on the majority of the patient care, and the government just told them, you don't count. This will devastate rural healthcare. This will destroy nurse pipeline programs. This will push people out of the field when we already don't have enough. And it goes into effect July 1st of 2026.
The Department of Education has now come out with a list of degrees that they are saying will no longer be considered professional. And this list will take effect July of 2026. Some of the degrees that they said are no longer professional include a physical therapist, an occupational therapist, advanced nurse practitioner, nurse practitioners, a physician assistant, teachers, a speech language pathologist, and there's more. But when I saw this again, I couldn't believe it. Because what does that mean on the back end? On the back end, that means that they are attacking female-dominant fields. That's a major blow right there. And secondly, people that are interested in those specific degrees will have a lesser chance in getting the federal funding that they need to get in those programs. And people voted for this. It's becoming to the point where y'all did not take Project 2025 serious. And it's sad. Because these people are stripping everything that they can away from the Department of Education. And it's sad. It's really getting on my nerves, and I'm just really getting sick of it.
I don't know if you know, but the Department of Education is trying to remove nursing from the professional degree list. And this is not just about a policy change. This affects everyone, including people going for nursing and the patients. For students, this means less access to financial aid, weaker programs, fewer clinical hours, and graduating with less preparation for the job. And guess what? Employers notice that. Lower standards equals a harder job market with likely lower pay rates. And for patients, you're going to be getting nurses who were rushed through programs, didn't get enough clinical training, and are expected to make increasingly complex decisions in increasingly complex conditions. And that is not safe or fair. Nursing is a profession. Patients deserve competent, well-educated nurses, and students deserve the training that keeps everyone safe. It's not just about school, it's about the future of healthcare.
Under Trump as Department of Education, several measures, nursing, physicians, assistant, physical therapy, audiology, education, and social work were reclassified and no longer counted as professional degrees. So now, here is the problem. When a degree isn't treated as professional, the program can lose access to a certain financial aid, advanced student loan, or special funding categories. So, that means 1,000 of students in United States in essential fields could feel the impact. And the craziest part, nursing is one of the most critical life-saving professionals. We have COVID showed the entire world how much we really rely on nursing yet. the classification was downgraded.
So tell me you want to crash the U.S. healthcare system without telling me you want to crash the U.S. healthcare system. So the U.S. Department of Education has proposed new rules that could reclassify graduate nursing degrees, like nurse practitioners, as non-professional programs. This change would significantly limit federal student loan access for graduate nursing programs by capping the annual loan amounts at a lower level than is currently allowed for other professional degrees like MDs and so forth. So why would they do this? Let's think about this for a minute. Let's look at Project 2025. Nursing is a female-dominated profession. Nurse practitioners, DNPs, and advanced nursing degrees are overwhelmingly filled by women, about 85% according to current data. Any policy change that limits access to advanced degrees or reduced pathways for professional advancement disproportionately impacts women, and they're going to frame it as budgetary reasons. A rule doesn't have to explicitly target women for it to functionally suppress female professional mobility. Project 2025 has openly stated goals like this. They want to return to traditional family structures, encouraging women to prioritize motherhood and baby making. They want to discourage dual income households that rely on government-supported childcare. These motives aren't hidden. These are written in their public documents, right? And advanced nursing degrees give women a high level of autonomy, a higher earning capacity, and leadership roles. And that's the opposite of what traditional ideology and Project 2025 wants. Project 2025 has also repeatedly attacked fields dominated by women. Think about it. Education, 76% women. They want to eliminate the Department of Education, remove credentialing, remove federal loan protection, reduce academic research opportunities for women, nursing and healthcare. They want to shrink the federal support for DNP and NP programs. They want to re-elevate the physician hierarchy because that's more dominated by men. They want to eliminate diversity, equity, and gender-focused health programs. Social work. The nonprofit sector, 82% dominated by women. They want to cut federal block grants, restrict the Title X, shrink the public sector jobs, and eliminate reproductive health programs. This paints a consistent ideological picture to weaken female-dominated professions by reducing federal support and classification protections. Advanced degrees allow women to earn $120,000 or more a year, operate independently in many states, run clinics, engage in primary care leadership roles, reduce physician dependency models, and rolling back this pushes women out of high autonomy roles and back into subordinate and lower paid positions. And this is a complete alignment with the Trump administration and Project 2025. Project 2025 specifically frames women working in high-skilled careers as anti-family. You know, they assert that America's decline is tied to the collapse of the traditional two-parent household and that the federal government should encourage women to return to the home, and that public policy doesn't need to incentivize careerism over family life. So they're de-incentivizing women's professional advancement, and it's just been wrapped in bureaucratic bullshit. This move isn't just about budgetary problems and money, right? Federal loans are a drop in the bucket compared to other budget line items like defense and all that bullshit. They want to reduce women's high-paying degrees, reduce access to women's high-paying degrees, reinforce the hierarchical male-led professional structures like with physicians and things like that, and engineers. They want to shrink the federal support for fields dominated by women. They want to push women back into domestic, low autonomy and subordinate roles. And they want to frame it all as a budgetary discipline or regulatory reform. Project 2025 doesn't have to say the words ban female advancement for them to ban female advancement, right? And decreasing the professional designations of nurse practitioners and nursing degrees will do exactly that. This will, if this happens, completely skyrocket healthcare costs because you're going to be more dependent on physician-led models. And it's going to decrease access to healthcare for millions of Americans because nurse practitioners are the only possible healthcare option for a lot of people in rural areas. You guys tell me what you think. Like the video, subscribe to the channel, and I will talk to you later. Let me know if you think this is complete and utter garbage like I do.
The information reaching me now is that the U.S. Department of Education is proposing to remove graduate nursing programs from the definition professional degree program. This is sad because what this means, or the impact to this, is that nurses who want to advance their degrees in nursing will have limited access to federal loans. And we know that when this happens, you'll be forced to go for private loans, which is ridiculously expensive. You know, private student loans are very, very expensive. The interest rate is high, and not everybody can afford to pay out of pocket. So this will even worsen the existing shortage of nurses in our facilities. We're already crying that we are short of staff, and now this is going to impact it more. And for you out there saying, oh, I'm not a nurse, it doesn't affect me, who do we take care of? We take care of patients. Because if you don't take care of people who are taking care of patients, how will patients be taken care of?
To the U.S. Department of Education, I just want to know, what kind of crap are y'all on? Are y'all on the pink cocaine? What are y'all on? So being a nurse is not considered a professional job anymore? So if being a nurse is not considered a professional job anymore, what's considered a professional job? Being a stripper? Being a TikToker? Like, what is considered a professional job? So the U.S. Department of Education just came out with a list of these jobs, and they're saying that they're not professional jobs anymore. What the hell does that even mean? On the list, I saw teachers. How's being a teacher not? What is going on? I feel like we live in the upside down world. What? Being a teacher is not a professional job. Being a nurse is not a professional job. Working in public health is not a professional job. Going to school and getting these degrees. Some people have advanced degrees in this field. You're telling me that is not considered a professional job anymore? Nurses, how do y'all feel? Being a nurse? Do you know how many nurses I know? Can somebody help me to understand what the fuck is going on? Because what does it mean that these jobs are not considered professional jobs anymore? Help me to understand, because I do not.
Guys, this isn't about politics. This is about student and the future of healthcare in general. If you know someone studying nursing, PA, PT, or social work, share this video with them, because it's not easy now. Guys, this is Rika's Tech. Thank you for watching. See you in the next one. I love you guys.